Good morning, everybody. This is exciting. We didn't anticipate this many people would be here, and it's always good to see the residents here. And thank you for coming out. Today is a great opportunity for this community. And not only do we get to celebrate the amazing partnership that exists right here between the city of Tampa and HUD that has allowed us to change the environment here in what was Central Park Village and is now known as Encore. You know, when you see the development that is taking place, when you see the lives that have been transformed, when you see the happy faces that I see here who now get to live in an amazing environment that is really helping to shape the core of our downtown area, we have to be thankful for that relationship and thankful for what Congresswoman Castor has done for us, and in particular, what Secretary Donovan has done for us. As all of you know, Secretary Donovan is the Secretary for Housing and Urban Development, and he and this administration have been nothing but supportive of this city in so many ways, not only just in terms of this particular project, but you look at the Tiger Grant that will allow us to finish the Riverwalk. You think at all of the changes that we've made in Collins Hill and Ponce de Leon. It has been a long-standing relationship. It has been a very, very productive relationship. And as a community and as the mayor, I am profoundly grateful to the support secretary that your agency has given to us. We couldn't change this city without you as a partner. And we are very, very grateful to this president and to you in particular. But there's another reason why we're here. We're here to talk about the Affordable Health Care Act. Now, that is an act. That is not a bill. That is not subject to debate. That is the law of the land. And that will continue to be the law of the land. In this community alone, there are 96,000 people that I represent that could be eligible for health care coverage as a result of what President Obama has done and what the Secretary is helping to implement. That is important. That changes lives. That gives people security who have never had security before. And I'll give you an example. As many of you know, my wife is an OBGYN. The choice that oftentimes she is faced with is a woman walks through the emergency room doors not having had any prenatal care. Zero. And the first doctor that she sees as she is about to deliver a baby is my wife. So the choice becomes, do we give people health care insurance? Do we give people coverage? Do we allow these women to get prenatal care so they can deliver healthy babies? Or the alternative is when they walk through that emergency room door, having not had prenatal care, they deliver potentially million-dollar babies that will be a ward of the state for the duration of that baby's life. It's an economic decision. Do you invest at the front end, or do you pay at the back of it? And I can promise you we're paying either way. So to give people the opportunity to get coverage, that is a game changer for this country. We're going to get it figured out. We're going to fix that website. We're going to make this work. And at the end of the day, there will be Americans, our fellow citizens, that will have insurance coverage that have never had it before and can make personal decisions about their health because they now have an opportunity to do it in the context of having health insurance. This is important stuff. This has got to work. It has got to work. We don't have any options. Somebody who's been a champion on this from day one is our great Congresswoman. She's been a great partner for me in Washington, D.C. She is there for us anytime we need her. She's a champion, not only on bricks and mortar projects, but on the human infrastructure that makes these cities so great. Ladies and gentlemen, your Congresswoman, my partner, Congresswoman Kathy Castor.
Well, thank you, Mayor. You know what it's like to live and work and raise kids in a city with a mayor that shares your vision for the economic stability in the lives of all of our neighbors, growth in our small businesses, a helping hand to everyone. Everyone deserves the same right to live in dignity as everyone else. I don't care where you come from. And that's why it's exciting today to celebrate Encore and to talk about economic stability, what is fundamental in people's lives. And we had an outstanding time bragging on what is happening here at Encore to Secretary Donovan. This is a partnership that has been years in the making. along with the Tampa Housing Authority, Bank of America, the city of Tampa, back in the day, the county, the residents, everyone that lived here before and then has had an opportunity to move back, the neighborhoods from Ybor City to Tampa Heights. This is a community that cares about its neighbors. And this is a wonderful demonstration of that, to restore what is Tampa's historic African-American community to its rightful place. A safe, clean place to live, but a dynamic new community here at Encore. And we are especially grateful to the Department of Housing and Urban Development for the $30 million investment in this community. Now, and in addition to housing being fundamental in families' lives, in providing that just the basic standard of living, a safe, clean place to live, a safe and growing neighborhood, affordable health care goes hand in hand with that. And at a time when this community is being reborn, we are able to accompany that with the most important law when it comes to people's health in our entire lives. I wasn't around when Social Security was enacted. I was pretty young when Medicare was adopted. The next pillar in economic stability for families across America is the Affordable Care Act. It's more than just a website. I'd like to take just a moment to remind everyone, this is more than just a website. The navigators that are working every day to connect people with a doctor's office in an affordable way are hearing stories of people that have never had the ability to have that affordable access to the doctor's office. Someone described it to me as being able to find water in the desert, that they have an affordable health plan. These are our neighbors that suffer from asthma or diabetes or cancer that have been barred from insurance coverage for years and years and years. And that's not right. That's not up to our values as Americans. In addition to that, there are young people all across this community that now have been able to stay on their parents' insurance. If you rely on Medicare for your health services, your prescription drug costs have gone down, or maybe the donut hole has been filled. You have free wellness visits that are very important. People who have insurance have rebates that brought money back into their pocket, back into their wallet, because we require health insurance policies to actually spend most of the dollars on health services rather than insurance company profits or CEO profits. This is fundamental change, and we knew it wasn't going to be easy, but in this community, we care about each other. Encore is a great example, and the men and women who are navigators in our community health centers, in our hospitals, in our neighborhoods are also important to that vision as well. So, Mr. Secretary, I'm so excited that you're here today so you can hear us brag about this wonderful Tampa community. You've met just a sampling of people who are helping their neighbors all across the entire Tampa Bay area and the state of Florida. I'm very proud to represent all of you, and I'm very proud to introduce to you the Secretary of the Department of Housing and Urban Development, our champion, our partner, Shaun Donovan.
Congresswoman, thank you for that very, very kind introduction. Much more importantly, though, thank you for your leadership. You have been a remarkable, remarkable community leader for this community. And I know you thanked me for the $30 million that we brought here to help make Encore happen. But let me tell you something. If we had 500 Congresswoman Castors up in Washington, D.C., we'd be doing this all over the country. You would see, you talk about an encore, we would see an encore and an encore and an encore. I only get to help communities where Congress gives me the ability to do it, and it's because of her leadership that we are standing here today and that we're able to celebrate. I want to congratulate all of you that have been part of this just absolutely beautiful effort, this redevelopment that we see around us. I was really moved by this tour. And one of the things that really came home to me, Congresswoman asked, how does this compare to what you've seen in other parts of the country with Choice Neighborhoods Awards? And I have never seen as extensive, as comprehensive a vision as you have here. This isn't just about the building that we're standing in. It's just not just about this beautiful new main square, really, for this neighborhood, and the revitalization of a historic African-American church into a museum that celebrates the culture here. It's about creating really a new neighborhood at a scale that will contribute to the vitality of this city. And one of the things that really struck me is you've got to have a mayor with real vision to have an effort like this. And so I also want to recognize that Mayor Buckhorn is a phenomenal leader, but he's a visionary too. And the vision that we're seeing come together here needs all of you, but you've got to have a leader in a mayor that really captures that vision. So, Mr. Mayor, thank you for your leadership. Now, what you see around us, it's going to include over 1,100 mixed-income housing units, 60,000 square feet of office and retail space, an early childhood education center, a new library, all of those pieces that make up a thriving community. But it's also going to have a state-of-the-art healthcare center. And we heard that there was a little good news yesterday. Secretary Sebelius made a $150 million announcement for the whole country for community healthcare centers, and 575,000 coming right here to this community. And this link to healthcare, the importance of healthcare to these efforts, it may be obvious to us, may be obvious to me, but let's just remember why it's so important. Because if a child grows up in an apartment like what was replaced here, with mold that causes asthma, or can't get the prenatal care that they need before they're even born, even if that child gets decent housing, they're not going to be able to get ahead in life. They're not going to be able to do well in school. They're not going to be able to succeed. And so if we really believe in the potential of all our children, we have to make sure that healthcare is a part of any comprehensive revitalization that we do in any neighborhood around the country. So that's part of the reason that the housing secretary is talking about healthcare. But let's remember something else. The seniors that are here celebrating with us, and I had the chance to visit just a beautiful, beautiful unit here upstairs a few minutes ago. They represent millions and millions of residents around the country that HUD helps to support with decent housing. Their average income is $12,500 a year. If you're paying hundreds of dollars a month for health care, or if you simply can't afford it at all, what does that mean for your life? What is the difference for a family that can now get $50 a month, the kind of health care coverage that they need? That's a huge difference in their lives. That money that they were using to pay health care costs can go to support so many other things. Maybe just put food on the table each month. That's a huge difference. And so better health care means residents are able to afford better housing and lots of other things in their lives. Think about all the young families. Part of my agency, it's called the Federal Housing Administration, we help 50% of all first-time home buyers around the country to buy their first home. What's the difference between paying $200 or $300 a month for health care and $50 a month? if you're trying to afford your first home. That's the difference between renting for the rest of your life and buying that first home. It's as simple as that. And what about when you get into the home? Let's remember that one of the and Florida has seen this pain too much over the last few years with the foreclosure crisis. What's one of the primary reasons that folks default on their mortgages? Healthcare emergencies. If you're not insured, it's one of the primary causes of bankruptcy and foreclosure in our country. So getting folks insured, it's not just good for their health care. It's good for their housing. And frankly, it's good for our housing market all around this country to have the Affordable Care Act. And I want to repeat something that was so important that the Congresswoman said. The ACA isn't just a website. Today, because of the Affordable Care Act, any person can be up to the age of 26, can join their parents' health care plan. Now, I don't know about you, I got a 14-year-old. I'm already worried about what he's going to do when he gets out of the house. My load is a little lighter because I know my son's going to be able to stay on a decent health care plan until he's 26. Seniors are already saving hundreds of dollars on prescription drugs because of deeper discounts. That's already happening. That's the law. That's the Affordable Care Act. Right now, no more lifetime limits that force people to lose coverage when they're in their greatest moment of need, when they're sick. Families are already benefiting from the ACA, and we've got to encourage more folks to sign up because everyone can benefit in some way, and so many people already are. Now, let's be honest too. The website has been frustrating. Nobody is more angry than the president himself. And as he said a few days ago, it's like having a great product in the shelves of your store and the cash registers aren't working. And I want to tell you, I have never seen him more determined. We are going to get this fixed. There is a big team of folks working 24/7. And my discussion with the navigators are here. It's getting better. It's going to get better. And he has pledged to have the website working as it was intended to by the end of the month. But we also got to remember there are other ways for folks to sign up. They can get on the phone, or, and that's part of what we're celebrating here today, they can come and apply in person with committed folks like those who are standing right behind me with the University of South Florida and the Tampa Family Health Center. And I just got to say, they are doing great work. We had a chance to spend a couple minutes together. They are doing fantastic work to connect families to the affordable health care that they need. And I want to thank them for raising the awareness, because we got to make sure families know. We got to make sure that people are coming in. And it's especially important here in Florida. That's why I came today. Now, you all know that the Affordable Care Act expanded the number of working families who could qualify for Medicaid. But it is up to states to decide for themselves whether to take this action. It is a no-brainer, a no-brainer. But unfortunately, a little less than half of the states around the country are too caught up in the politics of this issue to expand coverage for their own residents. Right here in Florida, 848,000 people who currently don't have health insurance could get it if the state just took this very basic step. All around the country, we're talking about 5.4 million people who have been locked out of getting Medicaid because of decisions that those governors, those legislatures have made. It is time for these states, including Florida, to stop putting political interests before the people's interests. It's as simple as that. And if they did, here's what could happen. The state of Arkansas, in 1 month, has reduced the number of uninsured people in that state by 14%. In the state of Oregon, in 1 month, has reduced the number of uninsured by 10%. And in the Tampa area alone, not just in the city, but in the metropolitan area, 467,000 residents are eligible for coverage under a Medicaid expansion or through the marketplaces that the president fought so hard for. They deserve action. Now, unfortunately, the Affordable Care Act has been caught up in the politics you all have seen. But at the end of the day, it is important to remember that this is not about politics. It's about people. The ACA will work for the American people. When we look back 20, 30 years from now, just as we do with Medicaid, we will say, this worked. This got the American people the health care coverage that they needed. The old system was broken, we all know that. And now, because of the ACA, families across the nation are going to have access to affordable quality care. It's good for the health of our communities, it's good for the health of our housing market, and it's good for the health of our nation. So let's keep enrolling people, giving them access to these great products, and we're going to do everything that we can in the administration to work on the website and to make sure that there are other ways for people to get enrolled. All of the navigators who are here, thank you. Continue raising awareness and guiding others through the process. In the end, all of this work will make a tremendous difference in people's lives. How do I know that? Because I've heard the stories. And here to give you her own perspective is a wonderful woman named Jerry Skinner, who knows firsthand how people are benefiting from the Affordable Care Act. Jerry?
Hello, good afternoon. My name is Jerry Skinner. I'm the manager for all the outreach and eligibility and also certified application counselors at Tampa Family Health Centers. And I just want to let everyone know that we have over 9 locations and more than 20 certified application counselors that are able to help the community to apply for insurance. We also have bilingual workers, so we don't have any obstacles of helping anyone that, not able to speak English. We had done for the last month of October over 230 applications for the Affordable Care Act. A lot of them were mailed because of the problems we're having with the computer systems, but we're still able to help anyone get their applications out. If you need help, you can call us or you can come to any of our locations. We're open Monday through Friday between 8 and 5. And I did want to share a success story that I had last week. I had a patient, she was female, 63 years old. For over 3 years, she had no health insurance coverage at all. By the time we were finishing her application, she was able to pick out an insurance plan with her tax credit that only cost her $35 a month. This patient almost cried in my office because she could not believe that now she was able to finally get insurance after 3 years, and she had pre-existing conditions, which before she was not able to get any insurance. So for her to only get $35 a month insurance, she was so grateful for Tampa Family to help her do that application. And I was blessed to be able to help her with that. And I just wanted to say that if anyone in the community needs help, please come to Tampa Family. We're there to help you. We also have other clinics in the area that is able to help you. And thank you very much for inviting me to speak. Thank you.